Thank you for opting into our page and getting this information about how to help people who suffer with fibromyalgia. My name is Dr. Keith Lynch. I practice here in Charlottesville, Virginia, where I've been since 1998. If you have fibromyalgia, you've got several symptoms which run together. Number one being pain. And that pain can be anywhere from in the head, throughout the body and the spine. You're also going to have fatigue. You're going to have sleep and energy issues. You'll also have digestive problems, and you may even have cognitive problems with memory and name and word associations. When we work with people with fibromyalgia, we address them both metabolically and neurologically. And I'd like to explain what that means. I'm going to start with explaining what we do metabolically. What we do is we run specific tests to find out which areas of your physiology are not working together. All of your organs in your body work together just like instruments in a big concert band, and they have to be playing together for things to be working right. I'm sure you've had several blood tests in the past, and you've probably been told everything's fine or everything looks pretty close to normal, or maybe it's low but it's normal. What I'm going to tell you is the lab values that they're using to check your physiology are very broad ranges. It's called the reference range. What we look at when we look at your blood values are optimal functional ranges. That tells us where you're supposed to be. Let me give you an example of what that means. Your TSH, or thyroid stimulating hormone, produced by your anterior and posterior pituitary, which tells your thyroid to produce thyroid hormones, the reference range for that is 0.5 to 5.0. What I'm going to tell you is that is a huge range. You could drive a truck through it. What the optimal functional range is 1.8 to 3.0. Now, did I come up with that range? No. That range was come up with from the Endocrine Society. They're the ones that are saying that's what it should optimally be. And the reason I'm telling you this is because when we look at your blood tests, we see patterns. Those patterns tell us which parts of the body are not working properly. And that gives us clues as to what's causing your problems. Now, at the end of this video, I'm going to give you an opportunity to come in and talk with me about your condition. I'm going to encourage you to bring that normal blood work that you've already had run from previous doctor's visits and bring it in so I can take a look at that and we can talk about what's there. I'm certain that when that gets looked at, we'll already be able to see the patterns that are starting to jump out at us that are telling us which direction we need to go with your testing so that we can get the rest of the picture. There's a pathway that I help people on when they have fibromyalgia. And the first thing we need to find out is whether or not you're even a candidate for this type of procedure. Now, there are two types of people that come into me. The first one is usually new to the condition. They've been recently diagnosed with it, and they've heard all these different things about fibromyalgia, and they're looking into getting it fixed. You're probably on medication for it. You're on amitriptyline, you're on Neurontin, you're on Ambien, you're on Flexeril or Celebrex. All these medications are designed to mask your symptoms. In other words, to make you think you feel better than you actually do. In other words, your body continues to run down even while you're on those medications, and that's why the dosages change in the future and things don't improve. They kind of stay steady and steadily decline. What I'm going to tell you is that if you're going to get this well, you need to realize that it's your responsibility to get it well. And when I say your responsibility, I mean it's not your insurance company's job. What they consider medically necessary once the diagnosis of fibromyalgia has been reached is that those medications may be covered by your insurance. Finding out what's causing the problem, that's not covered. That's your responsibility if you want to get well. If you are happy with what's already happening, then they expect you to continue on keeping on. Otherwise, it's your responsibility. Now, I said there's two types of folks that come in here. The second group of people, and maybe you're already in this group, has had the condition a couple years now. You already know what your outcome looks like. Because you've been diagnosed with the condition, you know what your options are. Maybe you're on Lyrica or you've already tried it and tried to get off it. Lyrica is an epileptic medication that's prescribed off-label, meaning not for what it was made for fibromyalgia patients. It's not some new miracle drug that's going to get rid of your fibromyalgia. Incidentally, if you're taking Lyrica, do not try to get off it without your medical doctor's help. It's a very serious medication that needs to be weaned down under the supervision of your doctor. If you've been on that, if you've had this a long time, you already know when I ask you, what has it been like the last 3 years? What does it look like it's going to be like the next 3 years, 5 years, 10 years down the road if you don't do something different than what you're doing now? If you're a candidate for this procedure, then you take responsibility for what happens. It's going to be your job to get these tests run to get your owner's manual. Did I say owner's manual? Yes. You need to know what your sensitivities are. You may have different sensitivities to different foods that are causing inflammation. Most of the medication you're on right now, if it's doing you any good at all, is anti-inflammatory in nature. So I'll ask you, what do you think is causing the inflammation? Many times I'll run into fibromyalgia patients that say, oh, I've got a great diet. I don't have any problems with any foods. I have no known allergies whatsoever, perfectly fine. The problem is that you're eating this food so frequently that you don't see symptoms that come and go with great distances between them. It's constant. You always feel bad. Every once in a while you'll have a good day for no rhyme or reason. This is inflammation. How do we know you have inflammation? Well, if we look at your blood tests, we'll see your C-reactive protein is high or elevated. We'll see your erythrocyte sedimentation rate up. We'll see homocysteine levels, if they're even tested, up. We'll see your uric acid levels up. These are all the things that tell us that you have inflammation. If you're taking an anti-inflammatory that's giving you any relief at all, it's from inflammation. You've got to know what's causing it. It doesn't just show up on its own. It's either the result of some kind of trauma or it's chemically influenced by your body. You need to be willing to get your owner's manual. You've got to run the tests to find out if you have these sensitivities. And if you do, you've got to be willing to make changes to your diet, to your lifestyle. If you're not willing to take that responsibility and make those changes, you're not a candidate for these procedures. After you have your owner's manual, we get together and we go over a plan. And that plan starts out with, how do we get rid of that inflammation that's there? Not just by using anti-inflammatories like aspirin, ibuprofen, Neurontin, Flexeril, but actually finding out what's causing it and getting that out of your life. That's step one of what we need to do to get you well. The next thing we need to do is we need to heal certain tissues in your body so that you're going to get well. Once again, we're doing that with diet, supplementation, and lifestyle changes. We're also going to use some other tools in our office to do that. We use low-level or cold laser to help improve healing in your body. We also use detoxification protocols to help decrease the inflammation and help your body heal. If you're trying to do this on your own, if you're going into the local health food store or the vitamin shop saying, hey, I have inflammation, what can we do to help that? And you've got some 20-year-old leading you over saying, this stuff sells really good. That's not how you take care of it. You need to be under the care of a doctor that can help successfully guide you to an improvement in your symptomatology. You can't just shotgun approach this. You can't play Russian roulette with the medications that they're prescribing. It doesn't work that way. If you've got intestinal upset, if you've got problems in through there, you need to heal the linings of that intestine. The only way to do that is to know what's wrong with it in the first place. That's part of our owner's manual testing that we do in our office to find out what's wrong and what needs to be addressed to get you well. If you've got sleep issues, if you've got no energy, if you can't fall asleep or stay asleep, if you drag yourself through the day with no energy only to find yourself unable to sleep well at night, you've got cortisol issues. Cortisol is produced by your adrenal glands as told to from your brain. If you have intestinal problems, the gut will get inflamed. Your immune system is going to react. The blood-brain barrier can become compromised, and inflammatory proteins called cytokines get inside of the blood-brain barrier, causing inflammation there, and that's where you get your cognitive issues from. What does that mean? Inability to remember names. Walk into a room, can't remember what you're looking for. My patients refer to it as fibromyalgia fog or brain fog. Those issues are neurological in nature. If you don't find out what's causing them and address it, if you don't heal that blood-brain barrier and then rehab that part of the brain that's not working properly, you should expect things to continue as they have been, because that's what's going to continue to happen. That's been my experience and my patients' experiences. When we've changed that for them, they have seen their life turn around. They handle stress better. They sleep better. They have more energy. They have less pain. I have many that have no pain at all anymore. But that's by finding out what the cause is and addressing it. Once we have your body working properly as found by your testing, we rehab it, get the brain, the body working together, and now it becomes a symphony inside your body as far as all the way your organs and your brain are working together. You can see improvements in ability to have more energy to the day, to interact better with your friends and your family and enjoy your relationships. Things can really change and get better. My name's Dr. Keith Lynch. I've been practicing in Charlottesville, Virginia since 1998. I help people who suffer with fibromyalgia. I look forward to helping you.